Now, sometimes when you fall down, there's a torquing movement that happens when you fall down. You may twist out of place. And you're not real sure what you've done, but here's a way of finding out if you really did pull the rib out or you've just pulled something around the ribs. Along the shoulder, you'll find that right in this area, there's bone, 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 and suddenly you find flesh. Now there's a V that is formed by the collarbone, by the shoulder blade, and it comes together in an apex, which is precisely the part that is where you'll find rib displacement. So I press with whatever finger's handy. The middle finger is often good. This is only a diagnostic point. It's not a treatment point. So I find where that V is. Sometimes I tap from the outside and find where finally there's a depression ability, or sometimes I'll follow the collarbone and then poke around, so to speak, till I find it. You press on the left side for ribs on the left side. And I'll bet this is a big surprise that you poke on the right side for ribs that are out of place on the right side. Again, these are just diagnostic points for the ribs. So my suggestion is you find a chiropractor or an osteopath, because at this juncture it's time to use their expertise to get the rib back in place. Ribs are pretty tricky. I mean, they're tricky even when you're eating them in the restaurant, in my opinion, but when you try to put them in a living human body, it takes a special skill, and they're usually brittle enough that you don't want to chance breaking or cracking them. So find a professional to help you put a rib in place, but you'll know to ask to have the rib put in place when you find these places sore. Now, while I'm on these places, don't forget, if you push down here, this is a way that you compensate also, same places, for low blood pressure. If you push here and you have low blood pressure, it brings your blood pressure up. That's just an aside why we're at the spot. But from there, we want to go on to another part, and that's the brain.